Good afternoon, everyone. Myself, Teja Vijjapu. I'm a scientist at Silicon Austria Labs. So today I'll deliver a talk on glucose sensor printed on algae-based substrate for eco-conscious point-of-care devices. So actually, this work was led by my colleague Emily, who is also pursuing her PhD at EPFL. So I'll take this opportunity to introduce about our laboratory, Silicon Austria Labs. So we are a research organization with the main focus of providing R&D services for European industries, especially industrial research. So focusing on industrial research and provide electronic-based systems. So we are located in Austria in 3 different locations, and we are more than 300 people, like from 40 different nations. Most of us are having PhDs, and this company was owned, majority of it is owned by Austrian government. So SAL is part of a European ecosystem for green electronics. This is a huge project with aim to develop processes, technologies, and tools for going towards green electronics by following 6R principle. So within this project, we have one use case where we aim to develop health monitoring sensors in a sustainable way. Part of this project, this work, what I'm presenting is part of this project. So you may ask, like, why you need such kind of devices or sensors. If you know, the fastest growing type of waste is electronic waste. And it is equivalent to 1,000 Titanics each year. The dump is equivalent to 1,000 Titanics that we are creating each year. And 10% of it comes from the health sector. And you may ask how. Let me take the diabetic care as an example. So almost 500 million people are living with diabetes, and almost 1.5 million people are dying every year because of poor diabetic management. So it is essential to have disciplined diabetic management to lead healthy life. But these patients often rely on conventional glucose sensors to take precautionary measures. But these sensors are for single use and non-biodegradable, and adding to the growing problem called electronic waste, because the waste generated is non-recyclable. And with millions of diabetics worldwide, the amount of environmental impact is staggering. So it is essential to have, there's an urgent need to have a sustainable point of care development, meaning to reduce the electronic waste in the point of care sensors by providing eco-friendly alternatives. So our aim is to develop printing technologies enabled eco-conscious patch. So this is the two component sensing system that we are aiming to develop. So it consists of reusable chip patch and a biodegradable sensor patch. So by following 3R concept called reduce, reuse, and rethink. And this biodegradable sensor patch is used to detect the biomarkers in the interstitial fluid. And whereas the chip patch performs the electrochemical measurements, process the data, and communicates wirelessly with a smartphone. And our approach is battery free because the electronic patch harvests energy from the smartphone, which is also used as the interface, thereby eliminating the need for additional electronic component by reducing the electronic waste. And this approach is eco-friendly. So in this talk, I'll mostly concentrate on the sensor patch, where we are aiming to detect the glucose biomarkers in the interstitial fluid. So the essential component of any kind of this disposable electronic these sensors is the substrates. So mainly the substrate required for printed electronics should be low cost and thermally and mechanically stable, and as well as non-absorbent. It essentially has to be ecologically bending, because most of these sensors are disposable, so it should not cause any kind of harm to the environment. So our main obvious choice was algae, because if you look at the footprint of this polymer that can be developed from algae is in the negative, because it is not just a biocompatible and biodegradable substrate. It can also sequester carbon dioxide from the environment, so helping the mitigating this climate change. So, and also the red algae is abundant in the environment, and we can easily produce abundant of this substrates. So having this, we have done multiple formulations, and we found that agar is the better one for this biosource substrate. And then we prepared this agar solution using agar, water, and vegetable glycerol, and we casted this agar and then dried, and we made a film out of it. And the secret recipe is to dissolve this in, immerse in calcium chloride solution, so to make it non-absorbent, and cross-linking it. You can see it is even resistant at very high temperature, like 100 degrees, and non-cross-linked one is almost degraded, but the cross-linked one was good. So this is important because if you do any kind of printing electronics, it has to undergo curing process. So it should be thermally resistant as well. So if you look at the sensitivity of these substrates for this moisture, and we have done some kind of characterization to see the moisture content, swelling degree, and total soluble matter, because we kept these samples like under the temperature of 100 degrees, and we immersed them in water and then dried again. So we did some kind of characterization, and you can see so the cross-linked one was much better when compared to the non-cross-linked one, and the moisture sensitivity was also improved, and the contact angle was also improved with the cross-linked ones, and you can see the hydrophobic nature was much improved in the cross-linked ones. So this is well suitable for biosensor applications. So coming to the sensor fabrication, so we did the substrate making, as I mentioned before, and we did this 3 electrode system. We printed this 3 electrodes using only carbon material, using screen printing, and then we encapsulated using microalgal wax, and then we broadcasted this enzyme. So we developed enzymatic glucose sensor, and you can see the one here. That's the sensor that we developed, and this is the prospective view of the sensor. We have a agar substrate and the working electrode, which is carbon, and the enzyme plus mediator, which helps in converting the glucose concentration to the Faraday current that is helpful to detect the glucose concentration. And we have an anti-interference membrane, which is a cation exchange membrane, which reduces the interference of other ionic species. So coming to the results, so we have done the cyclic voltammetry. So this is the black one is the one in the buffer solution. And you can see with the increase in the glucose concentration, and it has an oxidizing peak at 0.3 volts because of the mediator that we used. And if you look at the chronoamperometry results, with the increasing concentration, you can see the current is increasing. And if you look at the calibration curve, so this is a response. So we have got the linearity response up to 15 millimolar. So if you look at in the normal adult, so the glucose concentration is in the range of 3.9 to 7.8 millimolar in the interstitial fluid. So if it is more than 10 millimolar, so it is diabetic. So our sensor is well within the range of detecting if a patient is diabetic or not. And it has a limit of detection around 0.8 millimolar. And so this is the results of in the presence of other interferences. So you can see these are the ones like in the presence of lactate, uric acid, and ascorbic acid. So these are the potential interferons in the interstitial fluid along with the glucose. So we say that this sensor is also selective to the glucose in the interstitial fluid. So this is the conclusion. So we have developed carbon-based glucose sensors on algae substrate, and I would say this is completely eco-friendly, and it is biodegradable and biocompatible, and we used carbon as so the conductive electrodes. Thank you.